The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Oh, you took your badge off. That's how I introduce people. This is Maryam Zamani.
Yeah.
So you do skip all the other pieces in the middle?
I do. Okay, so it's a pretty fun story behind my last name. And so my full name is Sahib Al-Zamani. It's actually all one name. It has hyphens because my dad, when we moved here, thought it'd be easier for people to understand and be able to read it. It did not help. It just hindered. But what my last name actually translates to is Master of Time. So how kind of serendipitous that, it's like, oh, we'd rejuvenate, we turn back time. So it's like Master of Time.
That was fortuitous.
And I know. But it's actually it has a bit of religious tiebacks, which is why that's the name of a very influential kind of prophet in the Islam culture. So that's where it actually came from. But the literal meaning is Master of Time. So
anything with multiple meanings, it just that you have layers that you can untangle. It's so fun.
Yeah, so it's been kind of
that
a
is
fun
really
thing.
Special.
Yeah.
So your dad came here to the United States?
Well, we all moved here. So
Together.
I was born in Iran, and I was there until I was 11 with my whole family, and then we moved to Toronto, actually. So I'm Canadian. And lived there, grew up there, love it. It's such a great culture, so much diversity. And then I've kind of been hopping back and forth between the border. Legally, I did not climb over the wall. Everything I've done has been very legal and documented by USCIS. But so I did my undergrad at the University of Toronto, and I specialized in human behavioral biology, which is how fun is that? It was a mixture of psychology, biology, and philosophy. I thought it was the coolest thing I could specialize in. So I did that, and then I did my med school in St. Louis at Washington University, which is where I met my husband, who's actually from Northern California. So he was there for his grad school. He's an occupational therapist, was at the time, now he's in business. So we met there, and after that, I was like, I kind of miss home, so I went back to Toronto, did my residency there, and then just always chasing, growth opportunities and where I can learn more. I went down to Birmingham, Alabama.
Okay.
Roll Tide. And I did a fellowship. I know. I'm learning everything. I did a ASAP-sponsored fellowship with Dr. Grodding, who is just such an incredible gentleman. Oh, my God. I adore
so here's where
man.
we cross over, because I went to St. Olaf.
Ah, there we go. I love it. Very fantastic. Such a great culture there, right? Definitely love the southern side. And then I decided to go back home again, be close to family. So I did my practice. I started my practice initially for about 4.5 years. I was in Toronto, which was good during the COVID years, being close to family. But, it's just there was that pull of wanting to come back to the U.S.
Well, you knew what the sunshine was like now.
I know. I they gave me a little taste, and I was like, I want more. So, and my husband's from California, Northern California. So we had a deal. I said, listen, I'll move to California, but I need the beaches and I need the sunshine. I can't do the gloomy weather. So Southern California it is. So now we are in LA, Beverly Hills, setting up.
And are you working with someone else, or are you all by yourself?
No, I'm starting by myself. So I'm just starting off my practice. So hopefully my website's going to be launching very soon, and just having my little, not complete ribbon cutting, but the virtual ribbon cutting happening soon, and just taking off there in Beverly Hills. So very excited.
It is very common in Beverly Hills to be not just specialized, but really almost super specialized.
I know.
Have you thought about this?
I have. I honestly have, and that's it's hard, because I already feel as plastic surgeons, we do so much as plastic surgeons. And it's funny to me that even sometimes my own staff don't know the full gamut of plastic surgery. Listen, we do burn surgery, we do hand surgery, we do all of this head and neck, lower extremity, breast reconstruction, all of this. And so to already be saying I'm an aesthetic surgeon, that's a specialization within itself. And so when you start to when I find like when people want me to further subspecialize in that, it's a little bit hard because I'm already like, listen, I'm already saying no to a lot of things, and I love the full gamut of it. And I think that when you are really dedicated to that excellence and to understanding and growing in all the different aspects, you can do it all. I don't think it's, necessarily that you have to just be faces or noses or breasts or, the lipo person. I think that that's a little bit underestimating our specialty, how rigorous our training has been, and how much everything we do kind of translates and informs the other parts, right? The way I do my, the way I move my flaps in facial surgery helps me understand how I can do it in breast and body surgery and vice versa. How I manipulate fat tissues in the body is the same way of like knowing the principles of anatomy and the different layers in the face. So I think as long as you're dedicated to your craft and you can build into it, you can definitely do all of it. So I'm reluctant to say that I'm just going to be doing faces or breast or body. There's definitely areas where you get sought out more. I think that's where sometimes the specialization comes from, but I'm just not ready. And I think I don't know, maybe it's just us women. Like we can wear so many hats. Like this is just an extension of that, I feel like.
I had an opportunity, it was probably 2 years ago, to do this podcast in Beverly Hills for 2 full days. And so all we did was talk to Beverly Hills surgeons. And so I asked that question a lot. What do you super specialize in? And one person had a really different answer. And I've never forgotten it because the answer was, I specialize in women who are between the age of, I forget what it was, 35 and 55, who are, so the answer blew me away because his answer was not a procedure. His answer was a person.
That's interesting.
I thought to myself, that's the right answer.
Yeah. I think that's true. I definitely think that you cater to a specific, I think that it's what you put out into the world comes back to you. So I think it's that relationship building that we were just talking about, right? Yeah. It's about who can you make feel comfortable and vice versa. It's that bidirectional trust that you know that you're in your hands, you're going to be able to take excellent care of them, and that they're going to put their trust in you so that, that what you're trying to do can be fulfilled. So I think that's true. That's a very interesting way of looking at it, and I do like that as an answer. I'll steal it for next time.
I like it. I like that you like it because we are people, not procedures.
Absolutely. And I think that's the one thing we have to always remember at the heart of it is that we need to just remember that that's a person. And, sometimes I've been criticized for caring too much for patients, which is how is that even a criticism? And it sounds like, when someone's like, oh, what's your biggest weakness? Oh, I work too much, right? No, it's not that. It's literally people are like, you need to stop,
You're too invested?
You're too invested. I'm like, but how can I not be? The only way I can look at patients is that what if this was my mom or my sister or, my relative, and that's how I treat every single patient. And I know that, sometimes patients there's this thought that, treat patients differently. And I'm like, no, I only have one Steve. It's full throttle. I care fully and deeply about my patients. I stay awake at night for my patients. They get my attention all the time. I'm available 24/7. I cannot disengage because the level of trust that patients put in us is something that you just can't underestimate. And it's different. It's different than when you're in the reconstructive world or more medical, I'm making little quotation signs, medical specialties where it's oh, there's a disease process, you're making it better, or you're salvaging something, it's life and death. It's not that. We have very perfectly healthy patients who are living very fulfilling lives, hopefully, and we're trying to elevate that. And I think that the burden is much higher of making sure that you're just, doing that. You're to me, it's empowering patients, and that's where it is. And there's nothing that can, that should detract from that ever. So I think you have to take it super seriously.
I can see that you've thought about this a lot.
Can you tell it's been a bit of a struggle?
Are you a deep thinker? Do you find yourself pondering lots of things?
I don't know if I'm a deep thinker. I might be a deep talker.
Ruminator.
Ruminator. I think I just get, it's tangential conversations. Like
Yeah.
I just start talking to people, and it's where the conversations carry us. And I've just been so fortunate. I think I've just been fortunate to have met some people who've just made you think and instilled really great ideas in you. So you're like, you're an amalgamation of who you're surrounded by. So, credit to everyone else. I'm just
How
a
do you
little
lean
sponge.
into that in your day-to-day life? Do you read a lot of books or listen to podcasts? Or?
I think honestly, it is a little bit of your social circle. I think whether it's whatever level of life or whatever career path someone's in, right? I think that the common denominator that I've been very privileged to have in my family and friends is that they're always, every single person, whatever avenue they're down or going down, they're all trying to be the best at what they do. And so I learned so much from everyone else. So that, to be honest, like in day-to-day life, I'm actually trying to do more mind-numbing stuff. So that is just baking shows, my man. Like baking shows
man.
are the best. Master Chef, like next level.
I know. Yesterday, my brain was so full from all the great conversations I had that when I got home, that my house was upside down. And I just looked at the dishes and I was like, that looks actually good right now. And I did the dishes and it was so pleasant just to do like a task that I could start and finish.
Oh, I love that. I love tasks that you can put a check mark next to.
Yeah.
And I don't know what this says about me and my OCD nature, but to-do lists that you can like micro to-do and
Feels
put
so
little check
good.
marks
Do you
in.
bullet journal?
I don't. I'm not a big journaler. Honestly, here's the weird thing is I'm not great at calendars. I'm not great at journals because I find that the second I commit it to paper, I almost take that burden away from my brain and I'm more likely to forget it unless there's like an alert on my alarm. So it's weird, but I feel like if I have to force myself to remember something, I'm more likely to actually do it. So.
Oh, wow. Wow. That is like the absolute opposite of what the productivity people say to do, which is to get it out of your head and onto paper so that it doesn't roll around in your head. And that's what you do.
It keeps at the forefront of my mind.
Yeah.
It might be why I probably don't sleep well at night a
Oh,
lot
no.
of times. But it also, the second if I've already like put it down on paper, maybe part of me thinks I've already done it and I forget about it. So that's when I need my like alarms coming out.
Do you ever go to bed with a problem and wake up with the solution? Like your brain worked on it while you were sleeping?
I don't know. I wouldn't say that I quite have. No, I haven't had that. Although my husband did tell me one time he heard me reciting surgery as if I was teaching a medical student in my sleep. He was like, you were sleep talking, but not normal sleep talking.
Do surgeries have scripts? Like
Well, I think it's like
procedures?
I mean, there's steps, right? Like
Yeah.
that's how we dictate, right? As we like dictate the procedural steps. And he was like, you were telling someone like, okay, now make the incision here, and like, okay, retract, cut here, and then thankfully he's still here with me, which maybe like clearly I sounded psychotic in my sleep, but
Very
he's still
entertaining
here.
at least.
Apparently, yeah. It's like other people do like more fun kind of sleep talking, but mine is kind of more disturbing. It looks like.
Did you, in your undergrad, when you were doing that
The psychology.
hybrid degree, did
Yeah.
you look at any of those things about human behavior and
About sleep talking?
no,
Not in particular.
just about, I don't know. I was trying to draw a connection there between your education and your weird story.
No, there was absolutely nothing. It just that I'm a weird person is the only connection there. No, but my undergrad actually does really inform my day to day because of that psychology component. I think it's you understand people a lot better, and aside from just the individual person, you understand group behavior much better. And I think it also has been informative in terms of just understanding yourself and learning about like implicit bias and like unconscious
Yeah.
prejudice and things like that, and like just learning to just check in with yourself every now and then, be like, ooh, I think that there's I might be having a thought process that isn't totally fair. So I think it's been
You
helpful in
knocked
that
something
sense.
loose in my old brain, and this might be the first time I've ever said this, but I'm quite a bit older than you, I think.
I wouldn't know it. You look fantastic.
Oh, thank you. There was a lot of research done around breast implant, like breast augmentation buying behavior, and because I worked with a lot of people who were in that space in my career, I'm obsessed with conversion. That's the thing I chase all day, every day, is how do I get more people to convert?
Sure.
There was a really well-known sort of factoid for a long time that if you brought women into a consultation as a group and one of them bought, then the rest of the group was more likely to move forward too. And so that was the thing you knocked loose when you said that, was that I have to wonder if a group consultation, does anyone still do that, first of all? Like, is that still a thing? And if not, maybe we're missing the boat and we should try to bring it back.
Honestly, there's interesting element there that you said that. Not that I've tried group consultation, but there's definitely been cases where I've had like group of friends come in, more like in an injectable sense, and one person starts wondering about something, and it kind of like it
Yes.
informs the other.
This
They're
is
like,
why
"Oh, I
Botox
didn't know."
parties were a thing, right?
This is why Botox parties were a thing.
Cowboy boot parties.
Yeah, right. All of it is that it takes away. The way I would say it would make sense is that you're getting that positive feedback, right, and the reassurance that you're looking at. Now, I like it. Obviously, from a conversion perspective, it makes a lot of sense. The only thing that I always am a little bit cautious about in those settings is whether you're staying true to your patient's wants and needs, and whether they're being influenced to not doing something that they don't want to do. But for breast augmentation, for example, right, is whether there's like a little bit of mass psychology that's happening that's prompting them to go like bigger than they actually want to go to.
Oh, yeah.
Right. So I think that that's something that for sure initial conversations in group settings are fantastic, because it can increase conversion, but it also can make it a less intimidating environment once like the conversation gets going, for people to ask the questions they want, to inquire about the things they want, and so help propel things forward. But I think in those cases, it's always important to have that one-on-one check-in with the patient, probably at a future date, like in their preoperative appointment, to be like, hey,
like
let's
a
talk
second
about what it
consult.
is that you want to have, like how am I being true to you? And I think that's really is the core of what my philosophy is in my practice. Is I'm very much about the individual that's sitting in front of me. So I don't really have a lot of like cookie cutter approaches or surgeries that I'm like, okay, this is what you're getting and nothing else. Is that to me what matters is who's the patient, what is it that they're interested in, and what's their life looking like, and their, what's their needs and wants at this point, right? So a lot of times tummy tuck is the answer, right? If you ask like a group of like 100 plastic surgeons, show them a picture, it's like, yeah, tummy tuck, absolutely. But maybe that patient can't do a tummy tuck, doesn't want to do a tummy tuck. It's not in their need, it's not in their like recovery course, it's not, and they understand. The next part is that they have to understand that the results that they're going to get is not a tummy tuck result. But they still want that improvement. I don't think we should be saying like blanket no. So I'm a big fan of options and bespoke treatment plans for patients, so that they can get, it's about treating the human that's in front of you and helping them with what they're trying to achieve. So here we go.
This is well said.
Thank you.
I feel like we've gotten I haven't really asked you that many questions. We've got such a good sense of who you are.
Oh, thank you.
And you're really different from what I usually hear.
And that way.
And I think you're special, and I really like it.
Thank you. I appreciate that. It's a little bit of I think we have to be able to celebrate that in this space. And also, we have to, this is why I think diversity and inclusion is important, is that we have to hear the different voices and the different approaches and the different perspectives. And I think especially as a female surgeon, I think it's important. 98% of our patients are women, and one of the most important things to me is that I'm never doing a disservice to a fellow human, fellow woman, and I never want them to come back and feel that they were coerced into something, or weren't feeling heard, or So it's I find that it is a little bit of a different relationship I have with my patients too. Than it's more conversation or more relationship building than something that they may have been um, used to in the past with someone else. It's been great. I've enjoyed this. It's my first podcast, and
See?
it feels like two
You crushed
girlfriends
it.
having coffee together.
Yes. And I always learned so much. And, and I'll be super honest. Like when I get to talk to someone that is different from the mold, it's always really exciting because, it's not the same as everything else. Which of these things is not like the other?
Yeah. Which one doesn't fit?
Still amazing, but totally different.
Thank you. Well, I love the psychology spin on everything. It makes life interesting.
I
So
have
when you're
spent
doing that
a lot of time looking at, like, just tearing things apart to figure out how they work,
yeah.
especially around patient behavior and why they do what they do, and how do I put content in front of them that helps them get to know a doctor so that they do the thing we want them to do, but also so that you get the patient in front of you that you want.
Yeah.
So who are we talking to?
Yeah.
That's the question I'm trying to answer.
And that's I think that's so important because it helps both the patients, right? Like patients, so everyone's time is valuable. I think that's one of the first things we need to recognize. It's as doctors, it's really easy for us to be like, well, that's an appointment. That's like a consultation spot. That's valuable time. We're spending money on that. But I think we also have to respect it from the patient perspective. They're taking most often when patients are coming, they're taking time out of their job. They're using a vacation half day or PTO or something. They have to arrange childcare, someone to pick up their kids if they're coming for a late appointment or drop off. There's a significant
Logistics
that go into it. And when you can, prior to setting up an appointment, make sure that it's a better fit, it's just better all around. It respects the patient's time and their energy, and it also respects the staff's time and energy, and those synergies are the best. I think that's really important.
I think the worst thing that we could do is bring someone in who meets you and says, that's not what I was expecting. That would be so sad.
Yes, I agree. I think it's bilaterally sad. I get sad when patients don't connect with me either, because then I'm like, I hope it still was a positive experience on their
Nobody
day.
thinks about how it makes you feel. That's so...
I get very sad very often. Be nice to me, patients. No,
well, you're putting so much into them. You want the right people to connect with you. Absolutely.
No, I honestly, at the end of the day, if I think there's one thing I want my patients to know is I truly care about them. That's the part, is I truly care about them and I truly want them to do well.
I can see that.
That's the part that if I could be please just walk away with this. And even if I say no to a patient, which sometimes you have to, I really want them to understand that I'm trying to look out for them and work in their best interest.
I love that you just said that. So I make a podcast for an older kind of cranky surgeon in Alabama. Not the one that you worked for, but a different one. And we just did an episode for him that we came up with called 10 Reasons I Would Tell You No. And I haven't looked at the downloads, but when we posted the clip on social, there was patient after patient saying, LOL, you told me no to this thing and I really wanted to do it, but that's why I love you.
Yeah.
And we were like, wait, what?
That's amazing. I think when patients, sometimes they may not love you for it immediately, but hopefully if they heeded your advice, listen, it is hard for us to say no. You know how much work goes into making sure that patient gets to you. So for have them, and then your staff looks to you and you're like, I had to tell them no, and you can see all their faces drop, and you're like, but listen, it's because I'm looking out for them. I'm trying to do what's right here. So I think that's the hard part in this business, is sticking to your ethics, sticking to your integrity, and ultimately doing what's good for the patient. Well, those are the most important things.
Isn't it also true that when you say no, that some people will still go find someone who will say yes?
I know. And that's sometimes, I'm not going to lie, sometimes you find yourself in the predicament where you know that's going to happen. Yeah. And unfortunately, the person that's going to say yes to them is going to be much less qualified and much less invested in their care. So sometimes, I'm not going to lie, sometimes I'm almost tempted to say yes to that patient, because I'm like, I want to protect you. Like, maybe we don't do exactly what that is, but either if you're not going to listen to a no, which is like, let's downgrade you to something that's going to be safe. Because sometimes, like, I'm just worried for patients, like when they go out, and then the worst thing is a patient goes out and something unfortunate happens, and then, you know, you're then in a bind because you still want to help the patient, but it's one of those situations where you have to evaluate, right? Like, do I come back into this situation? Like, what's, you know, because there's that element of trust. They didn't trust you in the first place. Are they going to trust you this time around? So I think that's really important. Patients need to know that we place a lot of emphasis on their trust. And if we don't think that they're going to trust us and heed our advice, that makes us a little bit reluctant too, because we develop our programs, right, our preoperative and postoperative protocols very specifically. We strategize to make sure you're safe and you have the best outcome. And if we can't trust that you're going to trust us on that, things get a little bit questionable.
I'm glad that they have you looking out for them.
Thank you.
Okay, last question. This is the fun one.
Okay, I love it.
All right. When you're on an airplane and the flight attendant gets up and says, "Is there a doctor on the plane?" What do you do?
This is a hard one, right? Because of that dreaded level. I mean, to be honest, I do get up. So I have gotten up. If I'm awake, one time this happened and I was passed out and my husband had to shake me awake. But by the time I was like awake, someone else had like already gotten, they were already fully under control. I think it's the important thing in those situations is, you know, even if you're not feeling like, you know, I'm sure like an ER and an ICU doctor is like the best in that situation. If they step up, I'm like, all right, a plastic surgeon, I'm here to assist you as you need at this point. But I think we do have that duty to help.
You're from Beverly Hills, so I have an extra one.
Ooh.
This is my only for Beverly Hills question.
Okay.
Who is the last celebrity that you saw on the street, not in the office? I know you can't tell me if you saw one in the office.
Sure. Sam Elliott.
Sam Elliott.
Yeah.
Oh, he's amazing.
He was such a sweetheart. So, okay, I'm a newbie to Beverly Hills, so I still get starstruck a lot. And I'm really trying to control my reaction because I want to respect their, like, you know, they're out in the world trying to do their own thing. So this happened when I was working at a coffee, like I was sitting there working on my laptop at the coffee shop, and he came in and I was like, I see you, Sam Elliott. I'm very glad that you're here. He looks so cool, but I'm not going to go up and say hi. So I admired him from afar. So if you're a celebrity and I see you, I will admire you from afar, but I will respect your privacy.
Someday you're going to be overtaken and you're not going to, you're going to have to get a selfie. I'm sure it's going to happen.
Oh, I am.
Or someone's going to show up in your office under a pseudonym and you're going to be like, wait, I'm still a doctor.
Yeah, definitely. Those, you know what, though? I'm honestly so bad at, like, recognizing people's names that stuff like that's happened, and I've had no idea until they leave. And then my staff is
too.
Like,
did you know who that was?
And I'm like, no, like, XOX, like this person? They're like, oh, but that's when it's the bless your heart moment comes in. Bless your heart.
Oh, they got your back. Okay, where can we follow you online?
Okay, so I have a new website that's going to be launching, ZamaniPlasticSurgery.com, and you can follow me on my Insta. It's at Dr.Maryam Zamani. So find me there.
We will put that in the show notes.
Yay, amazing. Thank you.
Thank you, Dr.
Thank you so
Zamani.
much for this. This has been so much fun. And thank
My
you for
pleasure.
taking a first podcast ever. Shout out to Access.
You're so welcome.
Thank you.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.